As our Sales Enablement Virtual Summit continues, we're now going to get a customer perspective on sales enablement. I'm Jerry Rackley, Chief Analyst here at Demand Metric, and I'm speaking with Kent Potts, Executive Vice President and Chief Marketing Officer at Skura, and Kent has brought with him David Ross, Global Head of Salesforce Enablement for the Consumer Healthcare Division at GlaxoSmithKline. Gentlemen, welcome to you both.
Thank you, Jerry.
Before I start peppering you all with questions, let me provide our audience with just a bit of background. GlaxoSmithKline is one of the world's leading research-based pharmaceutical and healthcare companies. And David, I'll ask you to share a bit more about the company and the Consumer Healthcare Division in just a moment. In 2013, GSK generated core profits of £8 billion, or about $13 billion using today's exchange rates. Now, David is a former biology and chemistry teacher and has been with GSK in some form for almost 3 decades. He spent the last 4 years building a global Salesforce excellence capability within his division to maximize the impact of sales and marketing operations on the expert healthcare provider community. And that ranges from doctors and dentists to pharmacists and specialists who recommend consumer healthcare brands to their patients. David's global Salesforce effectiveness function focuses on delivering programs that improve the efficiency and effectiveness of GSK representatives in the field. And technology-enabling platforms like Skura play a major part in these programs. And we have Kent Potts of Skura to thank for getting David here, as David is Kent's customer. Skura was founded in 1996, and over 40,000 salespeople globally use Skura's adaptive sales enablement every day to bridge the gap between their businesses and how they execute with their customers in the field. Kent's an accomplished marketing executive that leads global marketing for Skura. He previously created a highly successful consumer products company whose clients included Walmart, Home Depot, Disney Stores, Costco, and Sam's Club. Prior to building and selling his company, Kent spent 6 years with the Walt Disney Company, where his role focused on the global marketing and distribution of innovative consumer products for the Disney Pixar brands. So, now that I've made those introductions, gentlemen, let me start with the questions, and I'd like to begin by asking David to please tell us a little bit about GSK, and in particular, the Consumer Healthcare Division.
Okay, well, look, GSK really is a global healthcare business with a focus really on 4 big platforms around our pharmaceutical business, our vaccines business, our HIV, and our consumer healthcare business. And myself and my team, we work within the consumer healthcare business, who have a very simple mission in life within the consumer healthcare business, that we want to be the first and best fast-moving consumer healthcare company driven by science and values. And the science within that mission statement is really critical to us because it's the science that enables us to drive recommendations from our expert HCPs, which of course then mean that patients become consumers and purchase our products.
Okay, well, I appreciate that additional background, David. So let's move into now the challenges that caused you to start looking for a sales enablement solution. Can you take us through those, please?
Yeah, well, look, I think realistically, if you look at the history over the last 20 years of any industry, a pharmaceutical, consumer healthcare, calling on physicians globally, whether that be dentists, doctors, pharmacists, to an extent, we all do the same thing. Everybody is very generic in the way that they approach physicians, and actually our communication pathways to physicians have become very stale. And I think we saw that, towards the late 90s, early 2000s, when physicians, in Western Europe and in North America basically started closing their door to representatives. They saw no value. Our challenge has been really over the past few years to say, how can we re-engage with physicians and bring value into the relationship that our representatives have with those physicians, but also really upgrade the way that we bring our science to life for these physicians through the use of technology-enabling platforms. So really what we want to do in a nutshell was get back to say, when a consumer healthcare representative goes in to see a physician, we want them to have a really meaningful interaction using content that's relevant to the physician, but also content that resonates with the physician, but something that we can bring it to life in a different way.
Okay, so David, it sounds like really then you're challenged with a value situation where,
Yep.
as you said, in the 90s, the doors were starting to close, and you had to figure out a way to reintroduce value into those interactions with physicians. Is that a pretty fair summary?
Yeah, that's a pretty fair summary.
Okay, great. Well, you obviously moved forward with probably a number of processes and technology solutions. Let's focus in now on the evaluation criteria and the process that you used to select a solution. Would you mind taking us through that, please?
Okay, no problem. I suppose there was really three things that we looked at because we started this process as best part of 3 or 4 years ago. I think number one for us, it's like everything. When you introduce new technology to a sales force, you completely and utterly transform the business processes and ways of working within the sales force. So before we even thought about bringing in a technology platform, we thought really carefully around the capabilities and the competencies that we would need to build in the sales force to be able to move from using paper-based assets into what would be hopefully become rich, interactive digital platforms. So really we focused a lot around thinking about and understanding what would the change in the business need to be and what would we need to do to change the business, to get the representatives ready so that when we gave them these platforms, they would maximize value. I think then when we came to look at potential solutions and potential vendors, a couple of things. At that time within the whole sort of closed-loop marketing space and the whole sales enablement space, there was very few, what I would say, global vendors, okay? There was a lot of small to mid-sized software companies. Again, one of our challenges that we had was to think about how could we work with a vendor and actually help them to work with what is a big organization, GSK, a big global organization, but actually work with them in partnership to take whatever their offering was, help to tailor it for the needs of our business, okay, but actually help that business be able to grow with us as we wanted to change and evolve the system. And I think the third thing, you know, like everything else in life, it's can we get an incredibly simple, straightforward, meaningful platform that's stable, that works every single time, that our representatives absolutely and utterly fall in love with, so that basically it would be virtually impossible to take it away from the sales force.
Well, and that, of course, is the ideal. Anytime you want to implement technology is to enjoy the adoption by the user community. In this case, it was your sales team. And, David, I also heard you talk about something I thought was quite interesting. One of the criteria was to find a vendor that was global because, obviously, GSK is a very large global company. And yet, I think I heard you, if I understand you correctly, say you were willing to invest in them at the same time they were investing in you. Is that right?
Yeah, I think that's right. I think that's very fair because I think as we move into potential leading-edge technologies, we may be, you know, present in 142 markets worldwide with 100,000 employees, but actually some of the new technologies coming through might be developed, you know, almost in someone's kitchen in a town in California. And that might be something that totally transforms the way that we operate, but how do you think about then scaling that globally, and how do you think about working with a small to mid-sized partner that you can help grow the solution to benefit, I think, almost a symbiotic relationship?
Yes, I would characterize it as well as perhaps very collaborative, it sounds to me like.
Yeah, because we don't know where we can take these platforms.
Right, and I'm sure you still have yet to experience, you know, the limits of some of these platforms. So where this ultimately led, David, is you chose Skura as your solutions provider. Now, you've just given us a wonderful explanation of your criteria, but can you talk perhaps a bit more specifically about why Skura was the right choice for GSK?
Okay. Again, I think what we what we did was within the business, not only within the consumer health business, but within my colleagues within pharmaceuticals, within vaccines, there was a number of parts of the business who were playing around with different solutions, different vendors, looking at what might be possible. There was a number of proof of concept pilots on the go. And ultimately what we tried to do within our business was align ourselves with our IT colleagues in the business, say, look, when we look at what's available out there today, what do we think is going to be the most stable? Which organization do we think that we can actually work with and partner with and grow with? Okay? And actually, which company out there has a focus on being able to deliver an operational platform today, but has real clarity around how they're going to develop that platform over time, and actually will form a partnership with the companies that they work with to co-create the future. And, at the end of the day, when we went through the whole usual RFI, RFP process, Skura came out at the end of it as the best solution for GSK at the time.
And David, how long ago was it? I'm curious. I recall in your previous answer you said about 3 or 4 years ago you sort of started this initiative. So can you kind of take us through the timing? When did you get to the end of that RFP process and make the selection?
So realistically, it was about 2 years ago that we made a global decision across GSK that we would work with Skura as our chosen vendor. Before we had sort of been in proof of concept pilots, and part of the proof of concept pilots was to try and help us understand what are the capabilities we needed to build in the organisation to get the right content on these platforms, from marketing, the way the reps needed to work, etc. So I think once we had gone through that growing pain of understanding what we needed to do to make it work, it was about 2 years ago, just over 2 years ago, that we made the decision that Skura would be the vendor of choice.
All right, and so 2 years ago you made that decision. Now let's bring us up to the modern day, the present day. What has changed at GSK since you implemented the Skura solution?
Okay, so what's changed? Goodness sake, I could give you a very long list, but let me start and say very simply. Like most organizations, we always struggle with having, most organizations have a global central marketing team that produce materials that cascade around the world that get implemented locally. And it was difficult to manage that process from global to local. Now the fact that we've got Skura, what comes from a central marketing team actually gets implemented absolutely perfectly in markets. So we've absolutely simplified that whole top to bottom chain in terms of content being created in the center, getting out, being used locally. What we've also done is we've built the capability to develop really rich interactive content on the platform. We've built the capabilities of the representatives who use that. And actually what we've seen, which is quite surprising actually, but we've almost doubled the amount of time that we spend on calls with the physicians. And that's purely through having rich interactive content that the physician really wants to get into. I think the other thing that we've got now that we're able to do more than ever before is really to be able to tailor content to individual customers rather than going in with generic stories, generic presentations. We have the ability within Skura to cut and paste the different content that we need to use for different customers. So again, everything is almost getting down to that individualized basis of the way we work together. But then at the back of that, and the thing that's probably changed my world most sort of in the center, my central team, is the fact that the data and the insight that we've got now got from our analytics platform sitting behind the Skura product. Basically we know every single minute of the day, basically, all around the world, exactly what content's being used, where it's being used. We then link that into our other metrics around the impact that that's having on recall of messages, around recommendations of our brands. And suddenly we can understand we've got another data point that gives us more insights into the impact of our campaigns.
Well, that's a pretty impressive set of benefits that you just described. I want to go back and ask you about one just because it really took me by surprise. You said, if I understood you correctly, David, that you have doubled the amount of time spent on calls with physicians. Is that correct?
Yeah, on average. And again, We can track this through our analytics, so we know exactly how much time has been spent on calls, what pages of the campaign we've used. We pre-benchmarked this before we introduced the technology, so we benchmarked where we were. Really in the old paper-based world, and then we move into the digital environment, and on average we've doubled, and that is across 7 to 8 markets where we're using this platform.
That's got to have a very significant impact on the bottom line, I would think, having that much additional time in front of your customer. So that's wonderful. I appreciate you detailing that set of benefits that you're getting. And we've had Kent on our interview here with us today, and he's so far sat there silently and listened. Kent, we want to hear from you now. So you've heard David tell his story. How representative are the challenges that David had for other customers who are also looking for a solution?
Well, they're absolutely bang on. Like the 3 things that come to mind are technology changes, global scalability, and delivering end-user customer value. Like in January 27th, 2010, it was a game-changing day in technology sales enablement, and that's the day that Steve Jobs unveiled the iPad, the original iPad. And since then, we've had 5 iterations of the iPad over 4 years. So sales enablement technology is fundamentally changing the way organizations engage with their customers. So what we're really delivering is that ability to go across an entire sales force, across multiple markets, and really bring end customer and deliver value to the end consumer in the material and the content that they're receiving.
So that was a game changer when the iPad came out. I would certainly agree with you. I think none of us really understood how far-reaching the impact of that device would be, and it's made an impact certainly all over the marketing world and other places as well.
Yeah, being lightweight, instant on, a 10-hour battery life, engaging design. Like GSK's healthcare professionals, the HCPs, they wanted to see content on that device. They wanted to touch and feel and use that device, and they do use it on a personal basis now. So the ability to enable that device to improve the sales experience, that was our goal.
So, David, let's jump back to you now. Talk to us in a bit more, if you would, about the impact the implementation of Skura has had on your business overall. You just did a wonderful job a moment ago describing the the benefits, but talk to us now about the impact. Where are you seeing the difference? How are you feeling Skura's effect on the organization?
Okay, there's probably two areas I would pick that probably has the biggest impact. So, number one, I would say it's completely re-energized the sales force in the way that they want to interact with their physicians, because they see the way that the physicians react to the content on the Skura platform, the fact that people want to interact. So we've almost got this, almost a complete refresh across the entire selling organization, that they just absolutely love to use the platform and calls, and it makes such a difference to them. And you know what? If you've got a happy, motivated sales force, then that's bound to have an impact on your bottom line. But I think the second thing to me is what I mentioned earlier, the fact that we've got the ability to drive a huge amount of analytics, closed-loop marketing data of this, integrate this with our other data sets to really understand what we're using in calls, what is impacting on the physicians, what is changing behavior, what's changing recommendation behavior, what's not working. We have the ability very quickly now to be able to change campaigns, switch campaigns on and off, do minor tweaks, get content straight out to the world, virtually overnight. Whereas before in the old world, it would take months to do anything like this. In fact, we wouldn't do it because we wouldn't have the data for the insights. So that's making us much more responsive in that if we put content out there that's working incredibly well, we can augment it. If it's not working particularly well, we understand why it's not working very quickly, and then we can make the changes appropriately. So ultimately, all of these will begin to impact on the bottom line.
Well, David, I love to hear you make the case for analytics, because I'm a big advocate of a broader use of analytics in marketing. And I think what you just described really reinforces the message that I share often with our members, and that is analytics take the guesswork out of the things we do in marketing. And that's what I hear you saying. You're able to make decisions about content and processes because of the analytics you're getting, and that's improving your overall effectiveness. And it's really no surprise to me, but it's always great to hear a real-life case study about that.
Yeah.
So, Kent, back to you now. We've heard about what's going on right now in terms of how GSK is using your solution. Let's look ahead. I'd like to have you tell us what we can expect to see from Skura in the next 6 to 12 months, or even beyond, if you wish.
Okay, well, Jerry, these are very exciting times for us here at Skura, and even more exciting for our Skura users. Number one priority for us is right now we are focused on data and analytics and insight. We're focused on the delivery of customer content, customer analytics, content analytics, channel engagement analytics to sales and marketing executives, and doing that all in real time. So we're going to continue to improve our dashboards and insight. Number two, expanding the channels of engagement. End customers are engaging and consuming content everywhere. Your sales team must also be everywhere and be accessible in any channel. With Skura, your team will deliver the message across all relevant channels, face-to-face, email, web portals, social channels, web conferencing, all from one sales platform. And number three, we are driving forward our predictive selling engines. Customers don't want information, they want answers. Our platform will deliver what message, what channel, what time, what frequency is best for your customers, providing a truly engaging customer experience. And these are the things we're working on right now, Jerry.
So I think I heard predictive analytics, if I'm not mistaken. Is that right?
Yeah, we have a dedicated team working on predictive analytics.
That's pretty heady stuff, but it's very, very impactful from all the research we've done here at Demand Metrics. So that is exciting indeed. Sounds like there's a lot on the Skura plate and a lot of things that your customers will be able to benefit from. So let's close out the interview here, David, by going back to you. And I'd like for you to just reflect on how important is the performance and reliability of the Skura sales enablement solution for your sales team.
Okay, so the great thing if you're in a paper environment, paper doesn't break down. Paper doesn't run out of battery. You can spill your coffee on it, you can wipe it down, it still works. We have moved our entire consumer healthcare expert sales force into a digital environment. We no longer have print media, so they have no backup to fall on. So therefore, we have to ensure that the platform retains that stability. So the stability to me and the quality of the stability is absolutely critical to give the confidence to the representative that they're going to take it out of the bag and it's going to work every time.
I'd love to just throw one other question out there because I think we have just a few minutes left. And I'd like both of you to answer it if you would. If, David, because this experience you have, you've been through this, you've implemented this, you're getting the benefits from it, you're in a wonderful position to advise others who are trying to get where you are. What advice would you give to someone who says, wow, we're back where you were years ago. We're all paper-based, but we know we need to move. What is the best advice you could give someone about how to get started?
So for me, I think the thing to get started with is to, first of all, understand your customers, understand what digital content that the reps would use will truly resonate with them. Make sure that you have the capability within your marketeers and your agencies, your brand agencies, to be able to build that content, and then truly think about the capabilities that you need to build within your sales force to have an interactive-based sell rather than somebody just sitting there with a paper-based almost tell-sell. So it's getting the organization set up right first, so that when the platform, all this platform is a technology enabling platform. It will not change you unless you change your business and your business processes and the way you work. It will enable what you do, and it will have a bigger impact on your customer.
Very good advice from someone who's been there. And Kent, how about you? I'll ask you the same question. Someone who's saying, how do we get started? How do we get to where we need to be? What advice would you give them?
Yeah, I'd say it's a very basic success matrix. I think you follow would be a crawl, walk, run, sprint approach. Crawling, you'd prepare and get all your digital collateral ready. Walking, you'd see would be managing the customers, distributing the content to your sales team to improve basic sales effectiveness. And then running, you'd shift to a more of a customer-centric focus, with specific customer success metrics in place and utilizing the engagement metrics to drive the business decisions. So you really utilizing the insight and analytics to tailor your content to, as David mentioned, to refocus and deliver the appropriate campaigns. And then sprinting, where you actually close the loop in selling process by integrating the customer intelligence and recommending the most appropriate sales approach for the reps.
Well, very practical advice from both of you. I appreciate it. I want to just say thank you for the time you spent with us today. I think our attendees who are listening to this are going to get great value from your practical insights. Gentlemen, thank you both.
Thank you, Jerry.
Thank you.